There needs to be a lot more emphasis on what a child can do instead of what he cannot do. Dr. Temple Grandin. 1 in 68 children has been identified with autism spectrum disorder and is 5 times more common in boys than among girls. That's 1 in 42 boys and 1 in 89 girls. One more fact that is even more frightening than the ones I just stated is that there is no cure. Although autism affects a great number of children worldwide and can be a life-altering disease for many, it doesn't mean that we as a society should set boundaries for these children. Let them dream as big as they want, and every time they fall, encourage them to stand back up and keep trying. Autism can only control their lives if they allow it to. What is autism? What are the signs of it? How is it diagnosed? What causes this disease in children? What role does inheritance play? How is autism treated? And what research is being done to help find a cure for this disorder? These are all questions that I think to myself when I hear the word autism. Autism spectrum disorder, or ASD, is a range of complex neurodevelopment disorders. Each of these disorders is characterized by social impairments, communication difficulties, restrictive and repetitive patterns of behavior. Autism is the most severe form of ASD, while other milder forms along the spectrum include Asperger's syndrome and childhood disintegrative disorder, usually referred to as PDD-NOS. This disease does vary in character and severity, but still occurs in all ethnic groups and affects every age group. The most common symptom of ASD is impaired social interaction. As early as infancy, a baby may show signs of this feature. Other common signs of a child with ASD include failing to respond to their names and often avoiding eye contact with other people. These children also have difficulty interpreting what others are thinking or feeling because they do not understand social cues such as facial expressions or the tone of a person's voice. Many children diagnosed with ASD also engage in repetitive movements such as rocking and twirling, and they also have a tendency to start speaking later than other children. It is not uncommon to see children with symptoms of ASD to have a co-occurring addition. These conditions vary from Fragile X syndrome to epilepsy. Although it seems as though ASD can be very hard to miss in a child, it may go unrecognized, especially in mildly affected children or when it is masked by more debilitating conditions. Healthcare providers often use a questionnaire or other screening instruments to gather information about a child's development and behavior. Some screening instruments rely solely on parent observations, while others rely on a combination of parent and doctor observations. Some very early indicators that require evaluation include no babbling or pointing by the age of 1, no single words by 16 months or 2-word phrases by the age 2, no response to name, and poor eye contact. Later indicators include impaired ability to make friends with peers, impaired ability to initiate or sustain conversation with others, and absence or impairment of imaginative and social play. Although these are just a few of the many indicators, if any of these indicators are seen by parent or doctor, it is usually indicated that more comprehensive exam is needed to diagnose a child with an ASD. For many years now, scientists have been studying autism, but there is one portion of it that they are not yet certain about, and that is what causes it. Everyone hears the accusations of what causes autism. One of the main ones being heard is vaccinating children. However, research is now delivering responses to this insoluble question. We now know that there is no one cause of autism, just as there is no one type. Scientists are identifying a number of rare gene changes associated with autism. Also, studies of people with ASD have found that in several regions of the brain there are irregularities, while other studies propose that people with ASD have abnormal levels of serotonin and other neurotransmitters in the brain. These abnormalities are suggesting that ASD could result from disruption of normal brain development and early fetal development, caused by defects in genes that control brain growth and that regulate how brain cells communicate. While these findings are a turning point for the process in finding a cure for autism, they are still preliminary and require further studying. Since scientists have found that gene mutations are connected to autism, what does that mean for the role of inheritance playing in what determines autism? Family studies strongly suggest that some people have a genetic tendency to autism. It has been shown in studies of identical twins that if one identical twin is affected by ASD, there is a 90% chance that the other twin will be affected as well. Also, in families with one child with ASD, the risk of having a second child with this disorder is approximately 5% or 1 in 20. This is a higher risk than the general population alone. Researchers are still looking for clues as to which genes cause this increase in predisposition. While researchers still haven't found a cure for any of the ASD orders, there are many treatment options available. There are therapies and behavioral interventions designed to help specific symptoms and can bring a great amount of improvement. Most healthcare professionals agree that the earlier the intervention, the better for the child. Educational and behavioral interventions include therapists that use highly structured and intensive skill-oriented training sessions to help children develop social language skills. Also, another form of treatment used in patients with ASD is medication. Doctors may prescribe meds for treatment of specific autism-related symptoms such as anxiety, depression, or OCD. There are other therapy or intervention options available, but few, if any, are supported by scientific studies, and parents should use caution before adopting any of these unproven treatments. These are very serious, complex disorders that have symptoms that can be easily overlooked. Researchers are doing everything possible to find the causes of this disease and stop it in its tracks, while doctors are doing everything in their power to treat the children and adults so that they can live a so-called normal life until the cures are found for these disorders. Each child or adult struggling with autism should know that they have a big support group behind them that are giving them a fighting chance by working each day on new studies to find a cure. And hopefully one of those studies will bring about, and hopefully one of those risk factors of being diagnosed with autism will be as low as they were 14 years ago and will bring about a cure for these people.
Very good. Very good.